Monica Walker here today to talk about another useful feature of Prognosis. Today we're going to be talking about our patient forms. Our patient forms give you the ability to automate the data entry of putting in the patient's information such as current medications, allergies, past medical history, family history, social history, so on and so forth. The patient forms are customized for your practice and they can be completed on the patient portal. They can also be completed on what we call Pro Check-in, which is a tablet-based system that gives you the ability to have the patients complete that information within your clinic, or you can have your staff manually input the patient information. On our home screen, we see the row of icons here that are our patient forms. Yellow forms mean that they are blank and nothing has been completed. Green means that we've reviewed the information and we have accepted that information into the encounter, and red indicates that something has been completed but not pulled into the patient's encounter that day. So I'm going to first go into this patient's face sheet so you can see that the information has not yet been completed. So by clicking the patient's name, it takes me directly into the face sheet. In the face sheet, you'll see that the patient's historical information, such as medications, allergies, they haven't been completed yet, they're blank. When I go back to my home screen and click on the patient form that is red, indicating that something has been completed, I can review all of the information that the patient has completed. And when I'm finished reviewing it, updating anything as necessary, I click the accept button. And that then pulls all of that information into the patient's face sheet so that I can view it where it needs to be in Prognosis. So when I click the patient's name to go back into my face sheet, all of the information has been populated into the appropriate sections of the face sheet. So I now have the patient's medications, allergies, past medical, and social history. These are extremely useful tools, again, in helping you reduce the documentation burden of having the patients input that information for you. The patient forms on the patient portal, as well as Pro Check-in, look exactly the same as they do for the staff within the clinic. You can utilize that information in multiple different ways. You can pull information into not only the information sections that we talked about in the face sheet, you can also utilize some specialty templates in this area. You can utilize these for some other standardized tools, such as the Beck depression screening, the PHQ-9 depression screening, the Oswestry, and the NEC disability indexes. Today, we've talked about patient forms within Prognosis. To contact us, please reach us at the details on the next page.